Hi all, welcome to Migrant Doctor Mom. This is Anna, and today I am in a different setup as you guys can see. I'm hanging out with one of a very brilliant doctor. I always tell you guys, Kenyans produce the best doctors, and today I'm gonna sit down with one of them, and we're gonna have a chat just about life, how things have been. So we're just gonna share Dr. life, and we'll start off by hearing. Dr. will tell us his name and what he's up to.
Okay, thank you very much, Dr. Anna. My name is Dr. Ngugi Wamuyu. I'm an orthopedic surgery resident. I'm a medical doctor and orthopedic surgery resident, currently in my fourth year of postgraduate studies in Kenya, at the University of Nairobi, Kenya.
Oh, perfect.
Yeah, so welcome to this Boda Boda edition
Yes, yes,
of the
yes.
show. Thank you.
Yeah, thank you so much for agreeing to join me.
Yes.
Just to give you guys a quick update, I've met Daktari here. We are out on a medical surgical camp, and I've actually seen him in action. So, guys, this guy is pretty good. I think you're almost towards finishing your training, right?
Yes, yes,
Yes.
yes.
So we're just gonna have a quick chat, and Daktari is gonna take us through why, why, why author, or where's your story? Where does your story start from? Tell us a little bit about you.
Thank you very much. I think my journey starts well. We did. I did my undergraduate at the University of Nairobi.
Uh-huh.
Did medicine, finished in 2016. Then after that, when there was a doctor strike, the
Oh
100
yeah, yeah,
day
yeah.
strike,
Oh my goodness, I remember
which we
it.
stayed home for quite a number of months, then finished and started my internship in 2017. Did it for a year, finished in 2018. And then after that, by then, there was no more automatic posting for MOs,
Oh, is it?
for medical officers, pharmacists, and dentists. So it had to hustle for jobs. So yeah, so of course now we finish internship, you apply for your license, then we did the hustle. So we polished our CVs, did some applications. I got a place where I started working in a town in Nakuru, then Naivasha, then I went to Mata Hospital in
Oh,
Nairobi.
cool.
Yeah, then worked there for some months, then got a job in the county government. So I worked for the county government in Nyandera for a number of months, about a number of years, about 2.5 years. Then I think I got tired of becoming a medical officer. I think being a chronic medical officer was not my thing. I was tired of the endless calls, those
I can imagine.
prolonged calls. Um, you're not being promoted, you still have to work as a medical officer for long. And then, of course, I think I wanted to do a bit of career progression.
Oh yeah.
So at that time, I had to decide, what do I do? I think I don't fancy internal medicine as much. I think I love surgery. So I think the decision was to
It
decide
was
what
easy.
surgical discipline
Okay.
it's going to be. So yeah, so
Did
that's
you
how I
always
found.
know it's author,
Ah,
or did it
no,
just grow? Did it
I
grow on you?
actually didn't think I will do ortho.
Okay.
I actually thought I will do neurosurgery or cardiothoracic surgery
Big stuff.
because I think it looked a bit fancy. But also wasn't my thing because for obvious reasons,
So how
guys
did
used
you
to
get
think
into it?
it
Anyone
was
inspired
easy.
you, or?
I think it was easy for me to get into it because one, our county didn't have an orthopedic surgeon.
Uh-huh.
Uh, two, it was easy to get a release because they don't have an orthopedic surgeon.
Oh, fair enough. Yeah.
Yeah, and number three, I was like, also doesn't require so much equipment, so it was easy
That's
to
your
get
phone.
released for
Okay.
ortho. Yeah, so I decided to become another pro.
Good on you.
Yeah,
Good on you.
yeah.
So what's been the experience so far?
Um, it's a good experience so far. I think
Okay.
I've gotten to learn a lot. I think ortho is a good program at the University of Nairobi.
Okay.
It's a good program because you're able to learn a lot within the program compared to
hands-on.
other programs.
Okay.
I think the department and the faculty are a bit more positive. They are good at mentoring
Oh,
people.
that's good.
They are good at supervising compared to other surgical disciplines. So I think we've had, and the hours are a bit more flexible. they're a bit better. So I think
Okay.
I am enjoying doing ortho. I think there are many opportunities. There's a lot of opportunities and networks that you can build. For example, now we're here because of ortho,
Okay.
because of the
Yep.
people I met in my program. So
Okay.
pretty
All right.
much,
Yeah,
yeah.
that's good. You know, I'm so used to like if you're doing residency,
Yeah.
like in Australia,
Yeah.
people get a certain number of hours a week, 40-hour weeks
Yeah.
and stuff like that.
Yeah.
What's your experience in your program? How
Um,
many hours a week do you guys end up doing?
so in Kenyatta, especially for the surgical programs, if I was to speak about the general surgical programs at the University of Nairobi, it's the hours are toxic. I would say the hours are
How many are
toxic.
you thinking?
Um, One has to attend a class from 7 a.m. on most days of the week. So literally 8 to around sometimes 8 p.m.
Oh wow.
You still have to do calls, you have to
Oh
run
wow.
clinics, you have to run theaters and all that. So I think the hours stretch. You might even do more than 100 hours in a week at times.
Wow.
If you, there are guys who've done more than 96 hours a week. Last week, I think we're having this discussion of
Yeah, we did.
we lost a colleague who had worked
Worked
for a very
so
long
much. Yeah.
number of hours and he had a pre-existing condition. So I think
Yeah.
the hours are a
A
bit
bit
quite
brutal.
strained, especially when you're a junior because of the more duties you cover. If you're rotating in the trauma rotation, there are more hours that you cover.
Okay.
So pretty much the department expects that you should do 60 hours a week. But in real life, I think we do much more
Much more than that.
than almost 100 hours a week.
Okay. So
Yeah,
what's your take on that? Because I hear people saying we did it, you
yeah,
should do it.
yeah,
Like we went through hell, you should
yeah.
also go through hell. What's your take on that?
I believe it's we should actually be moving towards changing that because
Times are changing.
prolonged working hours, um, sometimes unsupervised, is one of the reasons why we've had a lot of mental health issues among residents
You can imagine.
because of burnout. So we are having mental health issues because of burnout. Number two, we are straining the social lives of these residents.
Of
Remember,
course.
a good chunk of these residents have
Families.
families, they have other lives to live, so they're quite strained. Number three, financially, they're starved because you have to work so much in Kenyatta. And remember, previously, as a resident, it used to be that majority of the residents were government sponsored. Currently, most of the residents are
Oh, okay.
self-sponsored. So you have to pay your fees. You have to look for
Cost of living as
another
well.
job to do, so that you can make money on the side, so that you can survive. So when you couple all this, I think it's really putting a lot of strain
I
on
can imagine.
the doctors. So I think it's time that we really change that so that we have more flexible hours. So that
Do
I
you
think,
have any, they always say that we need to have like a way of having producing solutions.
yeah,
In your own words,
yes,
how do you see us changing this? What do you think can be put into place
yes,
to ensure that we are producing really good doctors?
yes,
And trust me, you guys are already so good.
yes,
And at the same time, we are not burning out
yeah,
people. We are not, because this has happened, of course, in other countries as well. Like, I
yeah,
mean, we are not burning out, but at the
yeah.
same time, we are producing the best of the best.
I think one of the things that we need to do is we need what is immediate, especially we need to look at those schedules in terms of how residents work, because we can actually create better schedules that have
I
less
can
hours.
imagine.
If the department, if the university says you need to do 60 hours a week as part of your program
Do you have the
requirements,
numbers though?
yeah,
Would you?
it's possible to
Oh,
do 60 hours.
okay.
Number two, I think we need to reduce the work these residents do. You'll find that residents
Yeah,
run
that's
Kenyatta,
true.
they run their individual facilities where they train in, and
Yeah.
those facilities have stopped employing doctors, so that these residents, because they feel these residents actually can be able to cover their duties. And therefore I think we need to think about it. How can we remove this non-residency work, in terms of, can we hire phlebotomists so that they can
Oh
be taking their
yeah.
samples?
Oh, do they
Yeah,
take samples?
yeah. Residents take
Oh
samples, they
wow.
do phlebotomy work, you follow up CT scans, you literally follow up blood for patients. Um, it's a lot. You do procedures in the ward. So this is work that will have been done ordinarily by a
I can
medical officer,
imagine. Yeah,
but most
you don't have
places don't
any.
have medical officers. So if we had hired medical officers to do the job, we hire phlebotomists,
So
and
you're a
those people, yeah,
phlebotomist, you're a medical officer, you're
yeah,
a resident,
yeah.
you are somewhat a consultant because sometimes
And
you work on
sometimes
your
a
own.
porter.
Sometimes a pot as
Sometimes a
well.
porter.
Oh
You
my
might have to
goodness.
go get that blood yourself and take it because a patient
Ah,
needs it. You
okay.
have to do so much follow up imaging,
Yeah.
intensifier machines to ensure that it's there in theater.
Mm,
So if that work was possibly done by someone else, we will reduce the workload the resident
of
has to do.
course. Oh, that would be nice.
Yes,
Yeah.
then the other thing is that at least provide other things like medical insurance for the residents for sure, because these self-sponsored residents have no medical insurance. If
Oh
they get
wow.
sick, they can't be treated in the facilities where they
Wow.
actually
So you
offering.
can't get the
Yeah,
service that you're
yeah,
providing.
it's that sad. So we need to provide medical insurance for them. The other thing is that since we have government sponsored residents who are being paid by the individual employers, then we should actually ensure that we have a stipend for these self-sponsored residents, so that by that they don't have to run around other facilities looking for means to
You know
survive.
something that I've seen in Australia is the residents
Yes,
are actually paid by the employing hospital.
yes,
So what happens is you get selected into a program
yes,
and then you actually look for a job.
yes,
So the college is different
yes,
and the employing hospital is different. So the hospital actually pays you.
yes,
So if you work overtime, they pay you for your
yeah,
overtime.
yes,
And most of the times then they have to balance out the timings.
yeah, yeah,
But they also, the other thing that I've seen is a lot of the theater lists
yes,
are run by a consultant and a
yes,
resident at the same time. So a
yes,
lot of times there's a
yeah,
bit of, provision of support.
yeah,
Okay, so I'm glad you do actually have potential solutions.
yeah.
Do you
The
think someone's listening, or do you think this is going to change in the near future, or how many do we have to lose before this happens?
I think before we even get there, I think it's time for some of these universities to actually build their own hospitals.
I agree.
For example, the University of Nairobi has been there for quite a long time. If they were to build their own hospital
Oh
where you
yeah.
attend to your only your patients within the university, then the residents would learn better and with less strain than when they are working in a government facility, which is quite overstretched.
I can imagine.
In terms of whether people are listening, we have agitated quite a lot. We have, in the last strike, the residents' issue
Yeah, I
was
remember.
part of the strike. Um, by the end of it all, we managed to have a clause within that return to work formula, which was to state that we should work if any hours worked overtime should actually be compensated
Oh yes, yes,
by the
exactly.
facilities, which so like what happens now in Australia where the facilities actually pay their own doctors, then we should actually have the same in we should actually have the same.
Sawa. Tuna record. Ngoja kidogo, enda kidogo. Sawa.
Aye,
Hai.
aye.
Just a minute.
So like basically what happens, we should actually have a system where these residents actually get paid.
Yeah, I agree.
Yeah, they
100%.
actually get paid. So we hope that the facilities can listen. We hope that the universities can listen. We hope that the ministry and the government can
As well
actually
can
listen,
listen.
because we have there's actually a strike notice which was issued 2 days ago, and I think 3 days ago, and the residents issue is still part of it. So we
Oh,
are continually agitating, continually having meetings with the respective partners or stakeholders, and we hope they can actually listen and do some of these things. Some of these things, they are different players, like for example provision of medical insurance, or if you can't
yeah.
provide that insurance, then allow those residents to
To
be
be
treated.
treated at
So
no
that's
cost.
something,
Yeah,
yes,
yeah.
the hospital can actually do. There are things the hospital, the university, or the training
I can
institution
imagine.
can actually do, and there's that which the government needs to step up and
Yeah. So
provide.
the morale is there to work because I believe, and having worked in Kenya as
Yeah,
well, I
yeah,
believe residents actually run hospitals. I mean, without residents, it would
yeah,
be almost impossible to run an
yeah,
institution.
yeah,
So I still strongly believe that and truly hope that somebody's listening
yeah,
and that we get a headway.
yeah.
Where do you see yourself next couple of years?
In the next couple of years, I'll be a qualified orthopedic surgeon.
Yay.
I think I'll I
Yay.
think immediately after that, I hope that I will possibly do some fellowships, possibly to maybe arthroplasty and spine.
Oh, good on you.
Yeah, I will hopefully have completed and graduated both from orthopedics and my master's in public health also.
Awesome. You're doing
Yeah,
both at the
yeah,
same time.
yeah,
You're a powerhouse.
yeah. And possibly, maybe you never know. Maybe we might get into positions of joining the
Yeah,
academic field and
exactly,
becoming
exactly.
faculty and possibly
Yeah.
train residents in a more healthy environment.
Yeah, and I
Hopefully,
hope you'll be that good boss,
I
You
hope
know,
so.
some people actually go through
Yeah.
it,
Yes.
and then as soon as they're on the other side, they
Yes.
are the
Yes. Yes.
nasty,
Yes. Yes. Yes.
nasty bosses.
I strongly believe in advocating for better. So we the same way you're advocating, it won't stop here.
Okay,
Yeah.
good,
So we
good.
hope it will be
Even
better.
as we wind up,
Yeah.
I see you're in Busia. You know, Busia is like so far away from Nairobi.
Yes.
Why the heart? Why Busia? Why did you want to get involved in this Made in Show thing?
Yeah. Busia is a town from one of the remote counties or counties which have not had very good health development and health
Yeah.
infrastructure. So I think I come from Nyandaro, which almost correlates with Busia.
Yeah.
If you look at Busia, some of the bigger towns which were previously provincial headquarters, they had bigger hospitals which had better staffing. So they had a lot of specialities and therefore they're able to offer most of the services. However, a county like Busia has only one orthopedic surgeon,
Yeah.
while
Sounding
other
quite,
counties have many. So
Okay.
the patient, there is a great need of providing orthopedic care to the patients and the people around Busia. So I think for me, it was more of giving back to the community
That's the word.
and just creating that impact. And I think that was evident from the smiles
Yeah.
the patients had
Exactly.
after the surgeries. So just ensuring that there
Exactly.
is a positive impact in the community was good. Number two, I think I really wanted to also participate in the surgeries. That's how you improve your skills and just build networks.
Yeah.
I think now we've built networks with the people from
At least
Australia.
now I know you. If
Yeah.
you hadn't come,
Yeah,
I'd
now,
not have met you.
yeah. Now possibly we'll do the next episode
Of
in
course.
Perth, hopefully.
Of course.
Yeah. So
Yeah.
so the networks and just creating that impact to the
Okay.
people,
All
and
right.
it's also a learning opportunity.
Okay.
And
So to the people in Busia and to everybody that's watching you,
yeah.
and even to the people of influence in Busia, is there one thing, just one thing that you would like to tell them?
I think they have some bit of work to do. I think we'll say that. First, I think we'll really want to thank them for welcoming and facilitating us just to be around. And the people also, they have been quite welcoming,
Yeah,
the
they have.
staff, everyone. There's a number of things that possibly they will do that will impact the daily lives of the Busia people.
Yeah.
So I think they need to put more money in the health departments. I think health is literally a basic need for all Kenyans.
Yeah.
So one, they need to ensure that they mobilize to have more people onboarded into the social health insurance.
Yeah, that's true.
Because when they are in the social health insurance or in any form of insurancing, then they can actually be able to afford
Yeah.
medical care. Number two, they need to equip the facility a bit more.
Yeah, I agree.
And that will help to facilitate the resident orthopedic surgeon. So let them have the image intensifier working, let them have the radiography unit working and operational in terms of having an X-ray that is functional
Yeah.
and a sustainable power. And let them keep capacity building the facility. So hopefully next time when we'll be coming back, there will be a proper operational
Yes, that's the
operation
hope.
attraction table and a proper orthopedic table and a proper theater and possibly even open more theaters.
I agree
Yeah,
with you.
yeah.
So there we go, guys. It has been lovely hanging out with Daktari because everybody else is leaving us, so we have to run along. But really, Daktari, thank you for all that you do.
Yeah.
I hope the change that you're trying to make today, it always starts off with something really tiny.
Yes.
But I hope that the ripple effect will be felt.
Yes.
And it is my hope that when you're a consultant,
Yes.
we're going to be different.
Yes.
And I'll hold you accountable for sure.
Definitely, definitely. I
Yeah.
hope we'll touch base in less than 10 years.
All
We'll
right.
have done a lot. We hope residents will be in a more healthy environment.
I agree.
And we hope the people of Busia will not have to travel elsewhere.
Sure.
They will be trained and they will be
Yeah.
treated in their own
Yeah. Yeah.
facilities better.
All right, guys, that's it for us. Thank you so much for joining us. And yeah, see ya.
So, yeah.